So let's start with our lecture topic, substance abuse and fetal malpresentation. And then first we will talk about the substance abuse. In this section, we will talk about the different drugs which come under the substance abuse and which have bad effects on the fetus during pregnancy. And then we will also talk about the effect of the alcohol abuse, which is very common in Western societies, even during pregnancy, and how it can affect and damage the fetus during pregnancy. So substance abuse is mainly, it can be associated with some social problems during pregnancy, and social problems which can lead to substance abuse is housing problems, crime, other children in care, or other abuse problems. So all these are some social factors that can make the pregnant women to do the substance abuse or use of some drugs which are prohibited, contraindicated, or should be restricted in pregnancy. Then some coexistent addiction with the other drugs, like coexisting addiction to alcohol and smoking is very common. And even smoking and alcohol abuse is contraindicated, or not contraindicated, we can say should be limited to certain safe levels. And if it's coexisting with the other substance abuse, then the effects of their use will be more damaging on the pregnancy. Substance abuse also leads to malnutrition, and malnutrition is especially associated with iron, vitamin B and C malnutrition. So again, malnutrition is itself is bad during pregnancy. The nourishment of the mother is important because the growing baby get all the nourishment from the mother. So if the mother is malnourished, then it affects the growth and development of the fetus also. Risk of viral infections are also common. They are also associated with the use of drugs which are used IV injections of the drugs. They can lead to more commonly viral infections. Different viral infections can occur, like HIV and hepatitis B in the patients who use the drugs. These are all the blood-borne infections, HIV and hepatitis B. They are transferred by the needles which are used, different people use the syringes, and also by the different transmitted by the blood. So then we have fetal specific complications, which are mainly neonatal risk, premature births, premature deliveries, and then we have intrauterine growth retardations. All these are different complications associated with substance abuse. So first, substance abuse can be started as a psychological and social problem. If there is coexisting addiction of smoking and alcohol, the effects are further aggravated, leads to different conditions and infections and neonatal complications. Different drugs that can be used as substance abuse. We have opioids, in which heroin, cocaine, or crack cocaine. Then tobacco is mainly as a smoking or smoke. Then we have alcohol and cannabis. And then intravenous injection, which can lead to blood-borne virus infections, Commonly, as I mentioned, like HIV and hepatitis B, both are very, very serious infections. If they are present during pregnancy, they can cause complications to the baby, and they affect the delivery also, and they can affect the newborn baby also. So these are the different drugs that can be used during pregnancy. Then what are the effects of alcohol abuse during pregnancy? The safe zone of alcohol use is less than 100 gram per week. So very, very limited use can be allowed during pregnancy, and excessive use can lead to different complications in the baby. So safe zone is less than 100 gram per week. It can cause fetal growth restriction if it's not within the safe range, and it can lead to fetal alcohol syndrome. So use of alcohol leads to syndrome known as fetal alcohol syndrome. And what can occur with fetal alcohol syndrome? It can damage the liver. Alcohol can cause liver damage in the adults also, can cause cirrhosis, liver damage, but in the newborns, liver is not fully grown and it is not functioning properly, so the damage is more serious. So it can cause liver damage. It can affect the kidneys and heart, so it can lead to kidney and heart defects. It can also affect mouth, teeth and facial problems, and hearing and ear problems. Alcohol goes into the mother's bloodstream, and from the mother bloodstream it goes to the baby through placenta and cause different complications and cause fetal alcohol syndrome. Then alcohol abuse, assess for psychiatric and addiction assessment. If the patient is addicted to alcohol use, usually the limitation is very, very unsuccessful. They cannot limit the intake because they are addicted to that. So assessment is very important, whether they have psychiatric issue or if they are addicted to alcohol abuse. And then in the pregnancy, it's very difficult to test also whether they have addiction, because the corpuscular volume and gamma glutamyl transpeptidase are not reliable tests in the pregnancy. Then the effect of smoking on the pregnancy. Smoking have different effects during pregnancy that can be very damaging, can cause perinatal mortality also, because it reduces the placental perfusion. If blood flow to placenta is reduced, then it can cause decreased flow to the baby. The blood flow is reduced, the nutrition is decreased. All that complications can occur in the fetus. Increased perinatal mortality, as I mentioned, increased deaths before the delivery and after the delivery are common with smoking. Babies will be smaller in size because of growth retardation, and there is also placental abruption. Placental abruption is the condition in which the placenta is separated from the wall of the uterus, and it can lead to decreased blood flow and bleeding, excessive bleeding, and excessive hemorrhages can occur that can cause even the mortality of the baby. So it can cause placental abruption and decreased placental perfusion. Smoking during pregnancy causes up to 2,200 premature births, 5,000 miscarriages and 300 perinatal death every year in the UK. So it's very, very serious. So it's important to quit smoking during pregnancy so these complications can be avoided. What are the effects of it can cause premature birth, low birth weight babies. It can affect the lungs. It cause problem of the ear, nose and throat, and it can cause diabetes. So all it increase the risk of complications. All these complications can also occur in these as a result of smoking. So it's very, very, very dangerous to smoke during pregnancy and should be stopped immediately. That was all about the different drugs and substances that can be, substance abuses that can affect the baby and the fetus during the pregnancy. Thank you for watching sqadia.com.